Hi everyone, I am so glad you're here for another episode of Ingrid's World. My name is Ingrid Paris Hicklin. On this show, meet Creative Image, whose services focus on the needs of the oncology community. Opening in 2004, Creative Images is a family-owned and operated in Chesapeake, Virginia. The goal of Creative Images is to help a person and their family regain control in a caring environment. They teach prevention and education on the various resources and products available before, during, and after treatment. Well, welcome to the show, LaShonda Ramsey and LaTonya Bond. Thank you so much for being here.
Thank you for having us.
So let's talk about, let's tell a little story about yourselves. Let's start with the owner of the business. LaShonda?
Well, my name is LaShonda Ramsey. I'm the owner of Creative Images, LLC. We have been in business now for 19 years. We were founded based on the needs of the breast cancer patient. However, we have expanded out into other patient populations, but we love what we do, and we're just trying to constantly open our hearts and minds to be able to provide any service that we see is lacking within our community. And we're also trying to make sure that our patients and our clients can find everything that they need in one place and don't have to hunt for it. It's very frustrating to have to go in different directions to find what you need when you're just trying to get well. And so that's our focus. We are constantly listening to our clients to try to make sure that we are meeting their need and meeting them where they are at that time, before, during, and after treatment.
Wow, what an amazing service you're providing. And LaTonya, I really just love what you're doing because you make it all possible too, working side by side. Tell our viewers about yourself.
Yes, I am the insurance coordinator, and my job is to verify the patient's benefits, and I explain how the insurance works and if they have any responsibility. So when they come in, I go over what they have, if they need to pay anything, if anything is due at the time of their visit, and what they are eligible for and what they may not be eligible for when they come in for their visit.
It's so important because that's really, as a person trying to get well, as was just stated, I mean, you really are just trying to put things together and you make it possible. Well, first of all, bless both of you because you're doing such important work, and I was thrilled to bring you on the show. So the why, I think you answered it, but would you like to elaborate it on more on why you started Creative Images?
Well, originally we started, I was just doing volunteer work. That's always been a part of my life, volunteering with different community initiatives, and breast cancer was one of those initiatives. As we were getting older and still volunteering, cancer became more personal within our own family. So as we were going through our journey, we started to find that the resources that we needed were not readily available. So I had an aunt in particular that was going through her journey. And as she was going through that journey, we were trying to find resources, and they weren't as easy to find as I thought that they should be. She constantly would tell me, sweetie, I need for you to do for me what I need for you to do for everybody else what you're doing for me. And as time went on, I kept saying, okay, I will. And I'm doing my volunteer work, but she really wanted me to create the environment for everybody else that I tried to create for her. And that's kind of how it got started.
Wow.
We started before that, but after it became personal, the journey to finding the resources just became so much more intimate. And it
Wow.
made me realize that we really needed to put together a program that was comprehensive, a program that was forward thinking, a program that was uh, that gave an external support system. We understood that the family was an internal support system, but
Right.
sometimes when you're going through and you're trying to be strong for your internal support system, it's nice to have an external support system that you can go to and just rely on, so that you're not constantly feeling that you're having to hold it in. We're the place that our ladies come and call when they just need to
Right.
release and then recharge and then go back to their internal support system.
So that brings to mind, what is the mission? I mean, what's your mission when you know that you're doing what you're doing is so important? What's your mission?
Our mission is to help any oncology patient and really any other patient population before, during, and after treatment, help them to recreate their image, help them to get back to being self, help them to continue to live in a situation that they may feel that they aren't able to live. We want to give them that control back.
I cannot tell you how important your work is. So many people needed those services many, many years ago, and now to be interviewing the two of you, who now, what you're explaining is just a beautiful thing about making this something that you can actually tackle as you try to save your life. So what are the services offered at Creative Services?
Basically, our services have grown. We originally started by providing the breast prosthetics, the external breast prosthetics, mastectomy bras, compression garments, as well as lymphedema sleeves. As we found that there were additional needs, and as the different procedures changed as far as breast cancer surgeries were concerned, we found that there were other services that were needed as well. We also provide wigs as well. To complement those services, I felt that in order for our services to be holistic, holistic as in complete and holistic as in meeting you spiritually, I felt
Yes.
that it was important that I get the training necessary to support those services. I am a licensed cosmetologist. I am a certified fitter of mastectomy with the American Board of Orthotics and Prosthetics.
Oh my
And I
goodness.
also am a certified lymphedema therapist. The lymphedema therapy came later on, along with the massage therapy, because we had so many ladies that were developing lymphedema as a result of breast surgery. We had ladies that were coming in, they had a mild case of lymphedema, but there was a shortage of lymphedema therapists. And as a result of that shortage, by the time they got in with the therapist, the condition was chronic. So I met that need. I decided to go back to school and become a certified lymphedema therapist so that I could meet the need where it was. Also, I wanted to make sure that not only were we providing that service, but that we were educating our patients in a fashion that they could take care of themselves. It's very important as you're going through the process to make sure that you educate, motivate, and empower. If we don't do that, then we're failing our patients.
Wow, wow. I cannot tell you again, the importance of what you do. Because, was it 20 years ago, the services that you're talking about, I can tell you, they didn't exist, And if they did exist, it was very hard to find. And so I love the fact that you're educating the patient. So let's get a tour, and we're going to get a virtual tour of your wonderful facility. And so let's start off with the Chesapeake lobby, and and tell us what happens there, because we're showing our
Well,
viewers that.
the Chesapeake lobby, which you see us sitting in right now,
Oh,
is where we do our intake. When the patients come in to us for any service that they are having, they come in through the lobby. They are welcomed in most of the time by the whole staff, unless we're in with the patient. But we try to make sure that the patient comes in and make sure that they are introduced to the staff. We are by appointment only, and we chose to be that way, not as a result of COVID, but we've always been that way. And we chose to be that way because we want the client or the patient to know when they come in that our entire staff is focused on them at their scheduled time. We are catering to the needs. We also didn't want them to have an audience when they came in. Sometimes you might be having a bad day. So knowing when you come in that you're the only one here and that we are catering to your needs and that the whole staff is focused on your case and nobody else's is very important to us. We've always done that, and we will continue to do that.
again, thank you so much for what you do. I tell you, I have firsthand experience about the difficulties it is as a breast cancer survivor warrior, and thank goodness you don't want an audience. You don't want an audience, right?
No,
Right.
yeah.
And then you have the Virginia Beach lobby too. You have another location.
Yes.
Beautiful.
Yes.
Beautiful.
We decided to open the Virginia Beach office just to meet the needs again of our patient population. The Hampton Roads area is a retired military area, but it is one of the largest naval bases in the area. So with that said, we always want to make sure that we are accessible.
Wow. And then you have the breast room.
Yes. Our breast room basically is where we take care of all of our fittings for our breast prosthetics, mastectomy bras. We do our compression fittings in that area sometimes as well. That is where the magic happens. We fit ladies for their mastectomy bras and their breast prosthetics and allow them to be able to see themselves whole again.
Again, being whole is just critical. It really is. Not having the patient go through that. Then you have another therapy room. Yeah, tell us about what takes place in each one of your therapeutic rooms.
Okay. We have our hair replacement and restoration clinic, as we call it. That is where we do all of our hair replacement. That is where, as ladies are losing their hair, we have them in that room to do, we can do custom wigs, we can do integration pieces. And when I say an integration piece, not everybody loses all of their hair. And even if they don't lose all of it, usually it's enough that they feel that they need to supplement. So we can supplement hair as well. If we have to do a total replacement, we can do that. We can customize wigs to accommodate our client population. If we have to the goal is also to make sure that you have somewhere that you can go that's private. When you're losing your hair, you don't want to have an audience watching you have your head shaved or watching you have to have scalp treatments. So the goal is to make sure that you have a private setting, but to still give you that option to go out and have services done. Even if we're just doing scalp treatments, even if we are just doing skincare, the goal is to make sure that you continue to have as normal experience as possible, but also take into consideration that it needs to be personalized and it needs to be private. We need to be able to have the option to do it, with compassion. We need to make sure that we are empathetic and we need to make sure that we are able to provide that in a safe, comfortable, sanitary environment.
Right, so important. It really is. And then you also have like therapeutic massages too.
We do. I became a licensed massage therapist and a medical massage practitioner, along with the certified lymphedema therapy training, because we had ladies that were coming in that, of course, were developing lymphedema, but they also were dealing with pain. They were dealing with cording. That comes as a result of having dissection or resection of the lymph nodes, and the lymph nodes is throughout the body, but a lot of times with the breast surgeries, the sentinel node, which is in the pit of the arm, is biopsy, and sometimes they're taking samples of lymph nodes leading up to that area. With that, cording can take place, and sometimes range of motion is limited. So I wanted to be able to address that. I wanted to be able to help ladies increase their mobility. I wanted to give them some comfort, and again, in a controlled environment. And I didn't want them to have to look all over the place to get it. I wanted them to come somewhere that they were already coming, where they were comfortable, and where they knew the staff was there to support them.
Thank goodness, thank goodness. I can tell some horror stories about trying to find services, and it's not pretty. And that's why I just admire the work that you're doing. It's really, really needed. I would actually have to say it's probably more needed now, because back when I was dealt with breast cancer, there was no such, there wasn't Facebook and Instagram and TikTok and the social media. But now it's a whole different story. So that gets me to my next questions. Tell us, how do you help a person recreate their image after diagnosed? Because I think it's not surviving, but help me recreate my image.
Well, we look at it as thriving. You know, the goal is to make sure that, as a breast cancer survivor, thriver, you don't stop living. You still have to do things socially. You still have families. You still have weddings and graduations. You still have a social life. You still go to work. So
Yes.
the goal is to make sure that we give you the resources, what we call, to keep them guessing until we can get there. The goal is to make sure that you look the way that you want to look. And sometimes we enhance that a little bit. We give you the opportunity to maybe try something that you would not have tried normally. So we have lots of ladies that try something totally different, and when they start to grow their hair back, they go to the new wig that we have, the style of the wig that we gave them, because it was just something they would have never tried on their own. But now that they've had the opportunity to try it, they cut their hair to that style, and
Right.
a bad hair day, they go back to their old wig. So we're happy about that. We teach ladies how to style themselves. Sometimes getting creative, ladies have challenges, and insecurities. We all do.
Wow.
And sometimes a cleavage line it's just one of the things that's a part of being a woman. However, there's so many other things that are sexy.
Yes.
Shoulders,
Yes.
lower backs,
Yes.
having a blouse that fits you properly, maybe with darts, so you can always create whatever image you want to, and our job is to find creative ways to help you do that.
So let's now talk about the staff that makes it work here. LaTanya, I would like for you to jump in there about how are you making this all happen?
Well, I assist LaShonda in different ways with the patients. as far as helping with some of the therapy sessions. I also help out when she is assisting the patients when she's doing the WIC consultations, and I also do assist the patients when they come in, when they have different questions about some of the products that we have and different services that we have and that we have to offer in the office.
Miss Ingrid, Tanya's being modest.
I'm feeling that. I'm feeling that.
She is our first line of defense. When they call in, Tanya is who they get. They love her. They love the way she sounds. They just feel love through the phone.
Yes.
And that's so important. When they come in, are you Tanya? So they know who she is. And it's important to us, for our clients, to know who we are, not just as caregivers, but as, like I said, as the external support system that they feel that they can tap into us as they need. And so our goal is to make sure that we are approachable. And so having her at the front desk allows me to be in the back, knowing that while I'm in the back, she's up front, making sure that all of our clients are taken care of. And that's one of the things I love about her. I could not do it without her and the rest of our team. So she's a part of Creative Images. Creative Images is a part of her now, I would think. She's been with us now for 10 years. And, when the patients come in, if she's not there, they're wanting to know, where is Tanya? So it's important to us that the patients know who we are and know that we are here for them.
Wow, that's like amazing. And I get that. So, where you do so much, and I would really like to just say, how do you stay motivated? Of all the questions, how do you stay motivated? Because what you're doing, that's not easy work. That's not like pushing, it's individual, and it's not hard. It's not easy at all. Very hard to me.
Miss Ingrid, how often do you get to come to work every day and know that you've made a significant difference in somebody's life? Every person that comes through your doors. If that's not motivation for you, I don't know what it would take to motivate you.
That's beautiful.
Our patients are our motivation.
That is absolutely beautiful. I mean, it really is. So sometimes, what are the words of, what's your words of inspiration for viewers who are out there dealing with breast cancer and they're dealing with the diagnosis? And I had mentioned to you, LaShonda, that I got a phone call from a person that says she lives in Texas, and I think I reached you and I said, and you said, well, our services, you actually have to come here. So, but how do you what's the first step of how a person should be dealing with this diagnosis?
Well, to your first question, what advice I would say is just always remember, you have cancer, but cancer doesn't have you. That's the first thing. The second thing is be optimistic in all that you're doing, because the energy that you give out is going to be the energy that you receive. The more you can decrease your stress levels, the better off you're going to be. As far as a patient that does not have direct access, meaning that doesn't live in the local area, you can always call us. There are so many resources, that we can tap into.
Oh, wow.
Even if it's not local. Just like we're having a Zoom meeting right now, we can do that with a consultation. The experience is a little bit different, but we try to make it as best we can. But the goal is to make sure that even if we can't help you, so we try to find resources for you that may be in your local area. We try our best though. We have, we're in a retired military area, we're in active duty military. So of course we have a lot of clients that have moved away. So we've had to get creative to be able to meet that need. So, if you have a need, call us.
Okay,
Let us
I love it. Yes, because I have viewers from all over the country. And that's really going to be the issue. How can I take advantage of it? And I love the fact that you're using, Zoom, different types of, virtual communications, and that's fantastic. Well, I will tell you that I'm thrilled to have you on this show. I can't thank you enough, LaShonda, Ramsey, LaTanya, Bond, for being on the show. You all are doing wonderful work, and it's inspiring. My inspirational quote is from Michelle Obama. History has shown us that courage can be contagious, and hope can take on a life of its own. Thank you so much for supporting Ingrid's World television show. I feel your fantastic support. Connect with me on Facebook at Ingrid's World and follow the show at Ingrid's World VA in Twitter and Instagram. Never miss an episode of Ingrid's World because the show is on YouTube at the YouTube channel Ingrid's World LLC or ingridsworld.org. Thanks for watching. You are the best.